following corrective exercise program has been designed with the fact in mind that the gastroc and soleus are playing an overactive role, while the anterior tibialis is playing an underactive role. The first phase of the corrective exercise continuum is inhibition, which can be achieved through self-myofascial release. Now, some individuals prefer the use of a foam roller. You can use a ball or various handheld devices. In this instance, I'm going to use a ball to complete an SMR technique that will help inhibit the gastroc and soleus, which will be completed on the floor. To complete this technique, you're going to apply pressure on the gastroc and soleus with the ball via gravitational force. So simply place the ball where you need that pressure point to be hit. You're going to hold for 30 to 90 seconds based on the applied pressure, and you're simply going to hold yourself up, applying the pressure onto that trigger point. The second phase of the corrective exercise continuum is the lengthening phase. In my particular program, I'm going to assign a static stretch for the individual to help stretch the overactive muscles, the gastroc and soleus. Simple stretch here. This can be done standing. If your individual needs to hold on to something, that's perfectly fine. With the leg that you're focusing on extended in the posterior position, you're going to flex the knee of your anterior leg, keeping your heel flat on the floor, and simply putting the ankle into a dorsiflexed position, which will cause lengthening in the gastroc and soleus. The third phase of the corrective exercise continuum is activation. In this phase, I have prescribed that the individual perform a dorsiflexion activity with the use of an exercise band. I don't have a resistance band available at the moment, so I have attached a bungee cord to the foot of a chair, and simply starting with applied pressure so that the foot is in plantar flexion, the individual will then dorsiflex up and then relax, and this will involve 20 repetitions in 2 sets. The fourth and final phase of the corrective exercise continuum is integration. Unlike the first 3 phases of the continuum, this is going to involve neuromuscular control of the full body and not only the overactive and underactive muscles that were being focused on before. In this instance, I have prescribed that the individual perform a lunge to balance. This means that the individual will complete a normal lunge, going to 90-degree knee flexion, but then as they stand, they will then bring the other leg, I'll show you in a minute, up to a 90-degree hip flexion and balance on one leg. Okay. So here is the typical lunge, and you'll see that there's 90-degree knee flexion. However, I'm going to come to standing and then involve 90-degree hip flexion to balance and then return.